So I thought I'd do a video now all about what psychosis is and how to identify psychosis in a person. Since I've been unfortunate enough to have gone through the system of psychiatric hospitals many times in my life, and the reasons for that are not particularly good reasons. Well, they're not particularly ethical reasons, should we say, and I've written about this extensively already, and you can check that out on my medium.com profile if you like to read about that. But yeah, in the course of my investigations, should we say, going through that system, I've come across a lot of different sort of people suffering from lots of different forms of mental illness. And I think mental illness probably affects everyone in their life to some extent, at least. Dead relatives die, people fall into depression, lose your job, yeah, anxiety, da 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 da. So I mean, yeah, lots of people obviously go through mental health problems, but psychosis is a particularly there's a deeper nuance to what psychosis is than a lot of people really realise. And psychosis, to be diagnosed with psychosis, you need to have one of three diagnostic criteria. One of these three diagnostic criteria need to be in place. You need to be either suffering from delusions. Delusions are beliefs that are contradicted by rational argument and evidence. So, for something to be a delusion, there needs to be clear evidence that would push a certain accusation beyond a reasonable doubt of being either true or false. And if and when the patient is presented with that evidence and they persist in believing something, then they can be diagnosed as being delusional. I've had some NHS psychiatrists actually assert to me that delusions are merely something that not everyone believes. That is most certainly not a delusion. Just believing something that not everyone believes in, or believing something that not everyone believes to be true, of course, doesn't make you deluded. It might make you a sort of heretic, and I think heresy, a somewhat workable definition of heresy is, yes, something that not everyone believes. Or an idiosyncratic belief that is rejected by large groups of people. It doesn't necessarily make you wrong, though. Yeah, I mean, Galileo was accused of heresy, obviously, as was Giordano Bruno, and probably Copernicus as well, I guess, since the Catholic Church used to teach geocentrism, not heliocentrism, and we know now, obviously, that heliocentrism is correct. So it's yeah, a strange thing to throw, and like throwing the term delusion at someone. That is, yeah, it's very potent. Accusing someone publicly of being deluded, it's as if to say, like, well, they've seen the evidence, we've seen the evidence, yet they continue to believe it. That's the implication there with invoking specifically the term delusion. So if that's misapplied, that can be used for, very dangerous, very nefarious purposes, I think. And in my experience, they've also had a tendency to use it arbitrarily. And they kind of twist and change language or seek to, or deploy trigger words, if you like. And there's a lot of NLP going on with these mental health people in the NHS. It's very, very creepy and disturbing. But, yeah, the next criterion is hallucination. And for something to be a true hallucination under the strictures of the Diagnostic and Statistical Manual for Mental Health Disorders, given out by the American Psychological Association, I think it is. Yeah, for something to be a hallucination, it needs to be an image or a noise or some sort of sensory or tactile impression that is not real, yet the observer of the hallucination believes it's real. So hallucinations, to be true hallucinations, you must lack insight into those hallucinations. Otherwise, everything that you imagine in your mind, say if you've got a song playing in your mind, or you're reciting a bit of poetry in your mind, or what have you, then yeah, obviously that's not a hallucination, because you know that that's just coming from your mind. So yeah, again, this is misapplied a lot, just to people who hear voices in their head, which does not make you psychotic even. The third one is formal thought disorder, and this includes all sorts of different kind of traits you'd associate with, yeah, truly psychotic people, I think. And I've seen some people, a handful of people, not many people actually, who exhibit these sorts of traits. There's a lack of responsiveness. There's like not speaking is one of the criteria. Then there's things like clanging and tangentiality and word salads, and these various other sorts of diagnostic criteria, which you do encounter in truly psychotic patients. The difference between someone like myself and someone who clearly is psychotic is stark indeed. With a truly psychotic person, you'd never be able to have a conversation with them. They'd just be talking tangentially. They might not even realise you're there, or they might have a vague awareness that you're actually in front of them. But yeah, they're not possible to engage in a conversation, or not meaningfully, if they're truly psychotic. And you see some like advanced cases of people who you can't sort of have a conversation with, but they'll go very tangentially and start talking about all sorts of crap, and you can't get a word in edgewise with them. And those people are psychotic, granted. And they just babble on and babble on and babble on about all sorts of stuff. Those are psychotic people. But someone like myself, you can interrupt and have a conversation with, and I'm not tangential. I sort of keep to the topic and don't skip around too much between different topics. And yeah, I have reciprocity in my kind of social cues, I think. And I would let someone speak in a conversation if they wanted to. And I try to respect sort of like social boundaries and all this sort of stuff. And, you know, they'll just like rush over to you and say, they did this, that. And then you can't get a word in edgeways. And it's like, yeah, psychotic people are really annoying. But I mean, I've never actually been one. And that's a problem, having that diagnosis. It's very confusing. But it's the only thing that could be used to affect the sorts of extortion that I'm imagining has been going on, or that these people have been trying to do this. Using mental health as a convenient avenue for that also. So, yeah, it's weird.